Welcome back to Session 2, Disclosure about Patients. The session will be co-chaired by Professor E.K. Yo, Director of School of Public Health and Primary Care, and Professor Herbert Long, Assistant Professor from Department of Clinical Oncology. May I firstly introduce Professor Long to introduce our first speaker. Professor Long, please.
Thank you very much, and welcome back. Good morning, everybody, and welcome back to the second session of our talk today. I'm Dr. Herbert Leung from the Department of Clinical Oncology, and sitting on my side is certainly a man which requires no introduction. This is Professor E.K. Yo from the School of Public Health and Primary Care. So it is our pleasure to chair the second session of today's program. And to start off with, I would like to introduce Mr. Terry Khan from the University of Hong Kong. Mr. Terry Khan has accomplished a Bachelor in Laws from the National University Singapore, as well as a Master in Laws from Harvard, and is currently appointed as the Associate Professor of Law at the Faculty of Law at the University of Hong Kong. He is also the co-director of the Center for Biomedical Ethics and Law, which is a joint center between the Faculty of Law and the Li Ka-shing Faculty of Medicine. His interests are in biomedical law and ethics, as well as in the governance of biomedical research. And currently, he teaches torts and biomedical law and ethics at the Faculty of Law at the University of Hong Kong. A native Singaporean, I believe a similar locality together with Professor Yo and myself. Well, he's from Epoch, but anyway, it's close enough.
It's my pleasure to introduce the next speaker, Professor Helen Chen, from the School of Nursing of the Chinese University of Hong Kong. Professor Chen's research is in quality of life of older adults, gerontological care and end-of-life care. She's been given quite a lot of awards in the presentations, and she's interested in bioethical issues. I think Professor Chen is going to give us an entirely different perspective. We've heard today from a legal perspective, from the doctor's perspective, by rules and regulations. I think Professor Chen's background and her research gives the perspective from patients because of her very intimate work dealing with end-of-life, advanced care planning, the involvement of patients and their families, and she's going to talk about disclosing patients' conditions to others. Professor Chen.
Good morning, still good morning. Thank you for the kind introduction. Actually, first of all, I would like to thank the Center for inviting me, because this is not only a recognition as a great honor for me, but also a recognition of the nurses, because nurses shoulder also very important duties and roles and responsibility when we talk about issues related to disclosure of patient information. So today, I would like to try to use different cases to illustrate the complexity actually involved in these issues. So when we talk about the duty to respect patient privacy, actually, as Dr. Kang has just mentioned about the law, the Personal Data Privacy Ordinance has clearly stated our duties, how we should act. And then in our Code of Ethics and also professional conduct, it is also very clearly stated. If we date back to the ancient time, actually, the role and responsibility in this matter has been well recognized in the Hippocratic Oath for doctors and even for nurses in the medical branch already. And even in our Chinese culture, we can see that in one of the ancient books for the traditional Chinese medicine on the absolute sincerity of great physicians has already mentioned that as a doctors, we should not talk about the patient matters in the public areas. So it is very clear that we should not disclose the patient information to the third party. As Professor Coleman this morning has also mentioned that this duty actually rooted from the role and the reasons that we have to respect the patients, and then we have to maintain the trust in the fiduciary relationship between the healthcare professionals and also the patients, and also to prevent the harmful consequences, for example, stigmatizations and discriminations. So if all these are so clear, why we still have to talk about this, why we still have to bother about these issues today? The problem is that maintaining patient privacy is not an absolute duty, but it is prima facie binding. That means, for example, within the healthcare team, it is on a need-to-know basis we can disclose the patient information to other colleagues. For example, during the cases when we want to make referral, we can disclose the patient information even without obtaining their consents. But sometimes we also ask whether this need-to-know basis may also apply to some important person. For example, people are very interested in those the affairs of the government officials and also the important persons. So are they also have to disclose their health medical information to the public? Do they have this responsibility? So sometimes you can see in the news that the public officials have to disclose their medical information to the public as an accountable actions. So likewise, not only in Hong Kong, in other countries, people are also very interested in the private life of the public figures. For example, in 2012, we can know that this has turned a happy event into a tragedy. At that moment, because everybody wants to know the information about the Kate Middleton and her first baby, so one of the radio programs in Australia tried to pretend as the Queen to make the call to the hospitals and want to get the first-hand information. And at that time, the hospital nurses are not aware of these important issues, and so she disclosed the information through phone. So this is a live broadcast, and then all the people at that time can listen to the hospital nurse about the information. And after this, the nurse is very regretful for about her mistakes, and then she commits suicide. So you can see that actually this can be, it can cause a lot of consequence afterwards. So you may also wonder if we have talked about this in our Code of Professional Conduct, not only for medical practitioners, but even for nursing council, we have Code of Professional Conduct. Why this case still happen? As the last presentation, we have stated that we have to obtain patient consent before we disclose patient information to the third party, and also in some exceptional cases only. But in the reality, we can see that there are lots of issues coming up. For example, when we are taking care of the older adults, especially in the Chinese culture, it is very common that family members often want to know about patient information even before the patient can get their own information. So sometimes doctor or nurses cannot get the consent beforehand. This is not uncommon actually in our culture. So because the family members very worry about that the doctors or nurses may disclose the sensitive information or so-called the negative information to the patient directly. And so especially if it is involving about breaking bad news or advanced care planning, that means talking about the end-of-life issues, often the family members want to intrude into the patient privacy. And on the other hand, I'm not sure whether you have also watched the movie Still Alice. Perhaps most of our attention is about the early onset of Alzheimer's disease in that case. But actually in the movie, there is another issue, is that about the genetic linked disease. Because in the story, the family members, the daughter and the son are asked to take a genetic test to see whether they are also having high risk with the genetic disease. So this also highlights that sometimes when we are talking about a disease, it's not only concerned about the patients, but also about the health of the other party. If we do not disclose to the family members that they are also at risk of genetic disease, are we leaving them with what we just mentioned about the serious harm, the risk to death or serious harm? This is another case in our local community. As Dr. Kwang has also mentioned, a similar case. So a person with mental illness has been discharged from psychiatric hospitals back to the housing estate. In this case, actually the mental community nurse has already identified this case as a high-risk case with violent behavior. But to maintain the patient privacy, it is not appropriate for the mental community nurse to disclose this information to his neighborhood. So because of the lack of alerts to the neighborhood and even the security guard, tragedy happened. The patient, after a quarrel with the security guard, has kill the person just because he is psychologically unstable. So this has warned us about the issue, whether we also have the duty to protect the third party. So actually the issue about to tell or not to tell happens since the Taraf's case early, a long time ago actually. In the case, it is about a university student in California. He actually fell in love with a girl, but he was very disappointed afterwards because the girl did not have the same feeling with him. At that time, he was so disappointed that he go to see the university counselor and even the psychiatrist. And then because he is so depressed, he wanted to kill the girl in that case. So the counselor actually alert about this issue and tell the police. And then the police actually has investigated into the case. In that case, but the police found him very rational and then released him afterwards. So the psychiatrist has tried to override the patient interest to disclose the information, but eventually he still failed to protect the girls. Eventually, the boy killed the girl, and then the parents tried to sue the psychiatrist because he failed to warn the parents and also the girl to be protected or to be alert with these dangerous persons. So I have been very bold to try to talk about the case law before so many legal professionals today. But what I want to mention is that we as health professionals often have to remind ourselves, on one hand, we have the duty to protect the patient information, but on the other hand, we also have the duty to protect the third party, especially if we know there may be a risk to their health. So we have to balance between the probability and magnitude of the harm and also the foreseeability and preventability of the harm. Okay, so when we talk about disclosing patient information, not only about the violent case, often we also mention about the communicable disease cases, for example, the sexually transmitted disease or HIV infections. Again, this is very clear that has been mentioned that on the practice of partner notifications, we have to try every means to persuade the persons who have the communicable disease or sexually transmitted disease to disclose the information to the person at risk by themselves. So again, this is very clear already. And in Hong Kong, we have the Hong Kong Advisory Council on AIDS having a guideline on this, how to guide the clinician to do the disclosure. But again, if you remember, several years ago, we have doctors who found HIV infection, HIV positive after he commits suicide. The Department of Health tried to call or approach all the patients who have been in contact with these doctors afterwards to do some screening tests. If we go back to the Code of Professional Conduct, we have said that doctors or all healthcare professionals actually only need to disclose their information anonymously, and they do not have the duty to disclose their own medical information to the council or their employers. But in this case, in the reality, we do in another way. So this is in line with an argument by the American Academy of Neurology saying that if the doctors worry that the patient ability or the patient medical condition may affect their working ability, for example, if he is a commercial driver, if he is having some disease, for example, epilepsy, syncope, or sleep apnea, or even dementia or Curie, they are still debatable whether seizure would be a medical condition that affects their ability to work. In that case, perhaps the doctor also have the duty to warn not only the third party. In here, we do not know who is the third party. So perhaps we need to warn the employer about his conditions without obtaining the patient consents. So here, I also try to use this case to close my 15 minutes presentations, is that this co-pilot, as Mr. Kong has just mentioned, he actually has already seen 41 doctors over the 5 years before the plane crash accidents. A lot of the doctors actually has been worried that he is psychologically unstable and he is not fit for fly again. but none of them have notified his employer about this dangerous case. So this also highlights that when we talk about disclosure of patient information to third party, it's not so straightforward as simple, and healthcare professionals often have to use their discretions to make decisions in this matter, how we can make the appropriate action on one hand to protect the patient information, and on the other hand also to protect the third party. And I'm sure in the following presentation, Dr. Deng will try to talk about this issue from the legal perspective again, and thank you very much.
Thank you.